Hello, I'm Mirza. Just wanted to share some of our experience with pharmacists in GP practices. So there's been growing interest in this whole area. For example, back in July 2015, the government announced a £15 million pilot to give patients access to pharmacists within GP practices. And back in October, so this is a couple of months before the community pharmacy cuts were announced, the budget was actually increased to £31 million. We've been in this sector since 2014. We started by looking after 3 practices in the coastal part of Essex, and since then we've grown our team, our experience and our expertise and the range of services that we're providing. Now we're looking after over 10 practices long term and many more on and off. So for me, I think pharmacy is actually splitting into 2 distinct areas. I think there's going to be a supply element and a service element. What we're doing in GP practices very much falls within the service element. In essence, we're here to save money on prescribing, reduce waste and improve the use of medication by patients. To give you an idea of what kind of savings we're making, well, the national average was, some years ago, was estimated to be £2 return on every £1 spent on a practice pharmacist. What we're actually seeing, according to some of the audits done by the CCGs that we're working in, is over £10 saved for every £1 spent. So that's a really good return on any investment. And also this doesn't include any cost benefits, such as decreased hospital admissions and reduced appointments with GPs. To give you an idea of some of the things we've been getting up to, well, it's not all drug switches from branded generic items. There is an element of that, but it's actually just a small element that's normally done by one of our technicians and completed within the first few visits to the surgery. Also, many of the surgeries that we're working in have an attached dispensary and or a pharmacy, so drug switches aren't always the most pragmatic thing. We started off with polypharmacy reviews, looking at patients with 10 or more items on their prescription. We found unbelievable issues that we could really quickly address and correct. We then moved into holding pharmacist-led respiratory clinics, so looking at asthma and COPD. We're now moving into QOF and one-stop clinics, so looking at different disease areas such as cardiovascular disease, heart disease. So it's an area that's traditionally been the mainstay of nurses. We're finding that a pharmacist-led clinic is actually very valuable, especially when the disease area is all about taking and managing a patient's medication. So practice pharmacy, well, it's not a new area of pharmacy. It's definitely an area that's recently been given a lot more attention, and I think it's opening up some really interesting opportunities for pharmacists to make a real positive impact in patient care. Thank you very much.